As well as treating the neck zone with the basic head and physio key, there are a number of electrodes which can help greatly. Now what I'm going to show you is 3 different electrodes. First the matrix, then the trigger, and then finally the fascia flow, how we can apply these in neck treatment. So it's really important for releasing tight muscles, getting in and working the neck area and releasing tight muscle attachments. So normally we would treat the neck like this, normal neck zone, as you've seen in your manual. So let's have a look at first the matrix electrode. So it's a little bit like fingers and good for large muscles here, getting in, and also it's a little sort of a cupping effect. So first of all, device is off. I'm going to put the matrix electrode on, and then I'm going to choose relaxation for the purposes of this demonstration. So I'm going into the relaxation and putting it on the skin of my patient, and I'm just going to turn it up till my patient tells me yes, I can feel that. So I'm going to check the other side. Is that okay?
Yes.
Okay, so now I'm ready to treat. So I like to wait until the screen goes dark so I can actually hold it up here. There's no need to hold it here, it's quite heavy here. So I'm going to work this area, and what you'll see is the redness of the skin come up pretty much immediately. And look at those lines. So it's a really good one to do. And the feedback I get from patients is they feel like that's fingers going in, and it feels very different to the standard electrode. Alright, so you can use that one. This is also good to use on things like thigh muscles and hamstring muscles. So I'm going to turn this off. Remember my setting, which was relaxation on 29, and now I'm going to change to the trigger electrode. Now the trigger electrode is a really good electrode, I find, for things like cross frictions on muscles. So what I'm going to do now is turn the device on to relaxation again. And I'm going to put the electrodes on there and check with my patient. You happy with that? So it's a different setting, so a different energy level. And what I'm going to do is I'm going to work these muscles. Really good for the vertebrae here, and I can go right up into the hairline and work the attachment here. And what I'm doing is I'm going to the attachment of the trapezius on the occiput here and cross frictioning. How does that feel?
Great.
So it's very different to this electrode, or this, that I can get in to the hairline where the muscle attaches to the skull and cross friction. So really good if you're getting release of tightness here, and often your patient will tell me, yes, but it's still tight just up here. That's where I'll change this electrode here, head. It's gentle, it's not hurting her, I'm not pressing, I'm just gently going back and forth. And what will happen is you'll feel the stickiness release. So that's a good one to work there. The final one I want to show you, I'll just turn the device off, is the fascia electrode. Turning that on, I'm going to use relaxation again. There's my head. I'm in relaxation. I'm just going to check that my patient can feel that? Mm-hmm. Okay, so remember it's focused, so you've got to be careful of the energy level. So this is where it becomes an extension of my hand, and I can actually work really closely on those muscles with a little bit of pressure, or you can work that way. How does that feel?
Really good.
And so there's a spot there on the transverse process of the neck here. the vertebrae here, and I'm just working that. I'm not pressing too hard, but I can feel the change underneath the tissue there. And I do the same way, working the neck muscles, looking for that stickiness, and it's just a much more focused area. So that's just an example of using the 3 electrodes, the standard electrode, your matrix electrode, trigger electrode, and fascia electrode, all on the neck zone.